Hey YouTube, it's Marida and welcome to another edition of the Nurse Lounge. And yes, you've seen this outfit, this hair, this lipstick 3 times now. I know it. I'll probably try to space these videos out. Just know today is recording day and I wanted to come up here real quick and get some videos out for you all. And I want to do this video. Well, first I want to give a disclaimer. So there are a lot of videos on YouTube, or a lot of nurse videos on YouTube, or nurse YouTubers. That's what I'm trying to say. There are a lot of nurse YouTubers on here who are giving great advice. They're showing great content, and they are definitely, doing well on YouTube. They're making plenty of money, things like that. And some people are doing those same things, but they're not giving such sound advice. And my concern with that is this. Many of you who come to nursing, who may be coming for the wrong reasons, are seeing the glitz and glam of nursing. And you may think that it's one way when it's not a certain way. You may think that this is the way to be. I want to make 6 figures per year, and I want to know how I go about doing that. Well, yeah, you got to work, point blank period. You working a lot to make 6 figures per year as a staff nurse on a floor. Unless you're doing travel, unless there's some type of incentive pay or something along those lines, you're working very hard. And so I want to, again, provide this disclaimer that when you come to my channel, I am a nurse educator. So I have no choice but to give you sound advice, because this follows me wherever I'm at. So I don't have the same objective, shall I say, as everyone else. I am monetized, as you know, but I can't make my living off of YouTube. So I'm not here to just, make videos to make money. It's great supplemental income, but I make my money from other sources. Again, so when I come to you on YouTube regarding nursing content, specifically nursing content, it is because this is my field of expertise. I happen to know nursing very well. And being a nurse educator specifically, I want to say that that's my job, is to educate nurses. So therefore, why would I tell you something that's false? Okay. I will tell you what I tell you is always research based. And if it is an opinion of some sort, I will always say, this is an opinion of mine. This is not, this is just my opinion. This is not research based. I always say that if it is an opinion. And I usually give you rationale as to why I do or whatever a certain kind of way. So I want to go ahead and throw that out there, because people have come to me and saying, these other channels are doing this, they're doing that. Let them do their own thing in the other channel. But if you're wanting to know truly what goes on inside of nursing, if you want to know what the criteria really is to get into nursing school, if you want to know what the best option is for you, if you want to know anything about nursing and know the truth, and the truth means that I'm going to tell you the good, the bad, and the ugly. That's what I mean by I say the truth. There's some things that are true that I may not even agree with, but I'm still tell you that. I'm going to still tell you these are your options, even though I may not agree with this option. I don't think it's the best route, but at the same time, these are your options. I'm not going to just tell you one way and say this is the way it has to be, with the exception if that's the only way it has to be. So, it is what it is with that. But for the most part, I'm going to give you options and say, this is what you can do in this situation, this situation, this situation. This is what I would do personally, or this is what fits my lifestyle, but you do what's good for you. So unfortunately, but fortunately, that little segment has nothing to do with this video, but I want to throw that out there because I'm having people come to me and say, hey, you talk about this, that, and the other, but the other YouTuber said this, that, and the other. The one thing I will say is, when you go into a situation, you take the meat, leave the bones, meaning you take what you can get out of everybody and leave the rest that you could not use. I don't like when YouTubers come and present things as a totality, meaning that this is how it happens always, everywhere, all the time. There is nothing in nursing that happens that way besides the fact of having to have a nursing license. You have to have a nursing license to practice, but outside of that, there's nothing that's in totality. Even in how we care for our patients, it's this situation unless it's this situation, but they present it like this was that situation for them, but we don't do that for them because they have this disease process. So again, nothing's in totality when it comes to nursing, besides again us having a nursing license. So definitely go to different channels, watch mine. I definitely want you to watch mine, but definitely watch mine and go to other ones and compare and contrast. And like I said, you have to figure out for yourself who's in it for the money and money alone, or who's in it to show the glitz and the glam. I don't really show glitz and glam on my, I buy things and I do things because I love to do things, but I don't really show glitz and glam because I wanted my channel to be a focus of truly what nursing really is. I do my other hauls and fashion, things like that. I do that for fun. But truly, when it comes to this nursing content, it is real content that is evidence-based. And then as time goes on, let's say, for instance, there's criteria or the research has changed, then I will start updating those videos to say, okay, this is the latest on X, Y, and Z. So, all right, that is enough of that. That was a long introduction. I typically don't do them that long, but this video, again, has nothing to do with that, but I just wanted to throw that out there. This video is talking about the NCLEX. I have failed the NCLEX. Now what? If you want to know more about what you should do after you fail the NCLEX, then you need to stay tuned. All right, we are back. My name is Dr. Marida P. I am a registered nurse. I'm also a nurse educator. I've been a nurse for 16 years. OBGYN, well baby nursery, is my specialty that I continue to love. And today I'm coming to you with a video specifically on I failed the NCLEX, now what? If you are still here because you got past that long intro, then thank you for staying. But I wanted to basically talk about, there's plenty of students who have told me that they have failed the NCLEX. So now what do I need to do? So let me go back before that. If you have not taken your NCLEX yet, so maybe you're watching this video because you want to know what to do in case. If you're not taking your NCLEX yet, the best thing I can tell you about the NCLEX is that you definitely need to take the NCLEX as soon as you can when you get cleared to take the NCLEX. Do not wait, and I repeat, do not wait months, and I mean like 5-6 months to take the NCLEX. I personally know some students who graduated in 2015. This is 2020 for y'all watching the future, who have not passed the NCLEX yet because they went to take the boards for the first time last year in 2019. Why would you wait 4 years to take the NCLEX? Why would you wait? It's one of those things when it's fresh, you have to do it. Otherwise you lose all of that. So first tip number one is if you haven't taken the NCLEX yet, take it as soon as you can after you get cleared from your school of nursing, and the board says that you are approved to take the NCLEX. You take that test as soon as you can. I graduated in May, and I think July sometime I took my NCLEX because it wasn't, usually it takes about 2 months. So usually you'll graduate 1 month, and then within 2 months, typically you're able to take your NCLEX. Now, with that being said, I don't know what's going on with COVID and how COVID is helping or hindering you all taking the NCLEX. So you may have to see your board of nursing about how that's going. So if that's an issue and you're delayed because of that I understand. But when it comes to you taking it on your own, this is what I'm talking about. Do not delay taking the NCLEX. That's number one. Number two, while you all are waiting to take your NCLEX, you should be doing at least 50 questions every single day. 50 NCLEX style questions. Go get you an NCLEX book. Get you a book and start going through those questions and answering them. Once you answer those 50 questions, then go to, either you do it one at a time or you do all your questions and go to the rationale. But my point, or no, don't do it that way. Do your question, answer it, go to the answer bank and find the answer and the rationale. Even if you got it right, read the rationale. Because again, the NCLEX is not talking about or wanting to know, it's not asking you to regurgitate facts. It's not asking you what COPD is. The NCLEX wants to know how you think. So when it comes to COPD and they give you the scenario, can you apply it to this situation? Can you apply the signs and symptoms? Can you apply the medications? Can you apply the patient's clinical manifestations? Can you apply the pathophysiology? Can you apply all those things to these disease processes to a patient on this exam? The test is not wanting you to regurgitate facts. They don't. What do you know? How do you think? That is all they want to know, is how do you think? So you should be doing 50 minimum. Really, to be honest with you, you should be doing about 75 to 100 questions. But you should be doing about 50 questions minimally every single day. If you all are in nursing school and you're watching this still, you should be doing at least 25 to 50 questions a day, even while you're in nursing school, every single day. Because what you're going to learn is when you do those questions and you read the rationales, it's going to teach you how to think. It's going to teach you how to answer those questions. It's like, what is it actually looking for? What are they wanting to know? There's plenty of times I've asked students questions and I'll say, what is this, this, and this? And they'll answer the question. They'll answer, but like, I'm like, that's not what I asked you. So if that's not what I asked you, that means you got the question wrong, the answer wrong. So again, make sure you're answering the question that the question asks you and not read things that reading into it. So that's a big, big issue when it comes to the nursing students in terms of them trying to pass this test. Now, again, this is not the video is about either, but I wanted to go ahead and put that in there because many of you will come to these videos, even if you hadn't failed it, but you like, just in case, let me go ahead and see what she's talking about. So I want to have that little part in there for you where, you know, I should be doing at least 50 questions per night, and I should be doing every single day, 50 questions every single day. And if it's a weekend, do 100 questions per day. So if it's a Saturday or Sunday, or if you're on break, meaning that you're between semesters or something like that, do 100 questions per day. If you run out of questions in that book, go buy another book. That's what I did. I'm only trying to take this NCLEX once personally. That's me. That's everybody. That was dumb. Disregard that. We all only trying to take it once. Okay. Ain't nobody trying to take it 2 or 3 times. However, you're like, okay, that seems overkill to do 50 questions per day. Okay. How many times you want to take this test? So go ahead and learn how to do it the first time. And then that way, hopefully you can get through the test and understand how it works. Okay. Now, the video is not even about that. The video is about, I have failed the NCLEX. So if you're still here 11 minutes and 3 seconds into this, thank you for watching it. But I have failed the NCLEX, now what? So this is what the video is truly about. You failed the NCLEX, so what should I do? So first I want to say, I'm sorry that this has happened. I want to say also, when you find out that you have not passed, I want you to go through the emotion that you need to go through. Meaning that when, you know, if you have to cry, you cry. If you need to be angry for a little while, be angry for a little while. Go ahead and have your pity party. Go ahead and vent, scream, cry, whatever you need to do to get that emotion out. Because until we do all that, we can't even really move forward. So go ahead and get the emotion out. That should take you maybe a few days to get past that. Once you sit there and get past that, those few days, now you need to think about when you took that test. Because I'm not sure if it gives you like an idea of what you passed or didn't pass, or what areas of concentration that you should focus on if you did not do well on something. I honestly do not know that because I passed mine, so I couldn't tell you. But anything that you know you had difficulty with, so the kinds of questions that you saw on the test or the content that you saw on the test, you're like, okay, I have no idea what this is talking about. So pharmacology was not your strong suit, that's what you need to go back and work on, pharmacology. If the test asks you a lot of diabetes or diabetic or insulin type questions and you know you're not strong on that, that's what you need to focus on. So even if it means you need to go back and study the content, go back and read your chapters on that in your textbook, and then come back to the questions, NCLEX style questions, to help you focus on that, then that's what you need to do. So that is the biggest thing you need to do, is for one, get the emotion out. Number 2, think about, maybe even write down the areas that you feel like I was not that competent in, and I really need to review that area. I will tell you, generally speaking, on the NCLEX, students typically do the worst in OB, pediatrics, and the fundamental stuff, believe it or not. So if they're doing the worst in those 3 areas and you feel like, okay, when I had my OB rotation, it was not my strongest, I need to go back and review that. Well, OB is on there. I will say culture is on there. Pain is on there. Pharmacology is definitely on there. And the newest NCLEX is about to come out. Is about to be a beast. So hopefully you all are going to have this video, or you're going to take the NCLEX before the newest one comes out, because I would fail the newest one that's coming out here soon. Don't know when it's coming out, but I'm just saying, I know I've already seen some of the questions on that newest NCLEX. Try to pass it the first time. So I have had my pity party. I have now wrote my list out of everything I need to review, or what I think I need to review based off what they asked on the test this time. Now, mind you, when you go back and take the test again, because yes, you're going back to take it again. When you go back to take the test again, it's not going to be the same questions. So again, you have to know the content, not just memorize a question, because it's the content that you have to know how to apply it. So go write that stuff down, go back to your textbooks and relearn that stuff. And when I say relearn, I don't mean memorize. That is part of the problem. You all have memorized everything. It's not memorization. It's you being able to take that concept and basically explain it to somebody else. So here's an example. If we were talking about somebody's heart rate going up, somebody's blood pressure going down, we know that to be compensation, right? So that's compensation. Why are we compensating? What is going on for us to compensate? It could be various reasons as to why we're compensating. Okay. The one that comes to mind for me is blood loss, which is hemorrhage or some type of blood loss. Okay. It doesn't actually have to go to hemorrhage or hypovolemic shock per se. But those could be some early signs or some late signs depending on what the disease process happens to be or what's going on with the patient. So I need to know what the mechanism, what's going on with the heart. Why is the heart pumping so fast? Do you know that? Can you explain that to somebody? Can you explain what hypovolemic shock, as an example, what it does to the body? Can you explain that to somebody else and break it down for them to understand it, not just recite a definition? If you can only recite a definition, then you don't know the concept. You need to know the concept. You need to know the medications that goes along with whatever disease process it happens to be. So when it comes to specifically someone who is losing volume, what do we need to do? Put the volume back up in there. Well, how do we do that? Fluids, for one. Also, if somebody's bleeding out, we need to maybe change your position, something like that. Do they need oxygen? Think about those things. You have to be able to think through a process. So if you're not good at those types of things, that's what you need to go back and review. So after you did that, then you go to your book and get the NCLEX book back out and start getting new questions and start answering those questions. You're going to see that you're going to have a better understanding of the questions themselves plus the rationale once you read them. Do those tips I just told you earlier. Answer the questions and then go look at the rationale. Even if you have them right, read the rationale so you know why you have it right. It tells you why you have it or why the answer is what it is. And that helps you better understand how they're asking the question. Now, fast forward. You've did that. When are you going to schedule your next NCLEX? As soon as you can. Now, I do believe, and I could be wrong, so if I'm wrong, definitely comment that below if you happen to know. It could depend on the state that you take your test in. This part I don't know for sure. But I think you have to wait 3 months, maybe. And don't quote me on that. That is not a fact that I know of. I think it's 3 months. So if you know something different, definitely comment that below. Let me know so I can correct it later. But do not sit there and think that's law. I don't know, because it could be different for different states. But about 3 months or so. So my point is this: whenever you are able to go back and retake that test, sign up to take it then. So that means, and I do think it's 3 to 4 months or something like that. If it's 3 months, come back around, go take that test in 3 months and be ready. Okay. Fast forward. Guess what? You failed it again. What I'm going to do, have another pity party. Like I said, after you have the pity party, then you're going to go back and think about the questions that you got this time and do those exact same steps that you need to do and go back and take it again. Now, I will say this. I highly recommend, before you take it the second time, that you go do some type of review. A Kaplan review, a Hertz review, a UWorld. Go pay the $300. I mean, I don't know how much it cost. $300 back when I was doing it, so it's probably higher now. But go pay whatever you need to pay, because for me, that Kaplan or that whatever review really helped me understand as well how to answer the questions. They went over the content very well, and then they gave us questions that, like, okay, this is how you would answer this question. So definitely invest in that. Now, actually would do that honestly, to be honest with you, if you are able to, if your school does not provide it, do that before you take the first NCLEX, if possible. If you can, go take a Kaplan review or anything like that before the first NCLEX. But let's just say you couldn't for whatever reason, or it's already done because that's why you're watching the video, because you didn't do that. Before you take the second or third time or whatever it happens to be, take some type of remediation type course or things like that. Take a Kaplan, the Hertz review, the UWorld review, some type of program that you can take that you can better understand these types of concepts that you need to learn. So go do that, and then hopefully you're going to see your score. You're going to either pass or you're not, because they don't really per se tell you your score. But keep doing that. So then you did that. Let's say, for instance, it's failure number 3. You're like, how many times are you going to do this? I want you to keep going until you pass the test, is what I'm trying to tell you. Do not ever stop trying to take that test, because you do not want that blood, sweat, and tears, everything you've done to get to this point, be the end for you. Is it fun taking it time and time again? No, it's not. But I don't want you to get to the point of saying, okay, you know what, maybe this is not for me. I don't want to hear that. If it wasn't for you, you wouldn't be here in the first place. Okay. This is just an extra challenge for you to begin to see, okay, I have to learn this material. This is going to make me the best nurse that I need to be. I'm going to be a great nurse. I need you to say positive affirmations to yourself that I'm going to do well. And then, before you take the test, make sure you know where the testing site is, for one. And you probably do if you've been there before. But the thing is, too, what are you doing to prepare for the test besides studying? Are you working the day before? Don't do that. Take off 2 days prior to your test, at least 2 days. If you're working a night shift, don't work night shift going to take those tests the next day. Don't do it. You need to, honestly, if you could, take off 2 or 3 days prior to your taking the test. If you're taking the test on a Friday, I personally wouldn't work past Tuesday that week. I wouldn't work past Tuesday. And for me, I think I took the whole week off, but to kind of study. But being that if you've already taken the test before, you kind of know how it goes. So I definitely wouldn't work on up until the day. But if your test is on a Friday, don't work past Monday or Tuesday that week. And if you're working nights, don't work past Monday night. You need to have some adequate sleep. You need to be eating correctly and properly. And you need to be doing that. And you need to be in the mental mindset of taking this test and not in the mental mindset of what happened with that patient yesterday or whatever. So don't go to work prior to taking that test. Have some days off where you can just really just kind of focus and kind of study. Now, would I say study the day before your NCLEX if you're taking it for the second and third time? Honestly, probably not, because at this point, if you don't know it, you just don't know it. But it's not going to hurt you to review a few things, but don't be cramming the night before, because again, you either know it or you don't at this point in time. Just, maybe do a few questions. If you want to do, say, 10 questions that night, just like, okay, I got it. Do not spend a lot of time on that, because your brain needs to rest and get ready for the test the next day. Now, with that being said, if you are someone who can take the test in the morning, most of us do best first thing in the morning after a good night's sleep. Schedule your test for a different time of the day. Maybe you took the test the first time at 3 o'clock in the afternoon, and you've been stewing all day that day, and things were coming up and people were talking crazy, whatever. No, take that test first thing in the morning. Be at that testing center 8, 9, 10 o'clock in the morning, get that test done. Do not wait till the end of the day to take that test. That's a big thing. And I don't do that with anything. Anytime I have to schedule something, when I schedule my dissertation, I scheduled my dissertation at 10 o'clock in the morning because I wanted to be well rested, but at the same time, I didn't want to stew over it all day. I wanted to get it in, get done, and get out. Go take that test as early as you can. Also, eat you a breakfast that morning before you go take that test. Eat you a good breakfast. Drink you some water, not so much to the point you have to go pee all the time, because it's hard, it's distracting to get up and have to go take that test, or take that test and get up and leave and have to get, kind of the way they do testing sites, and they have to monitor you trying to get in and out. So don't drink to the point where you have to go pee all the time, but definitely be hydrated and make sure you eat. The brain needs fuel to work. So you have to eat in order for you to do better on the test. It's just like having no gas in your car. How far you think you're gonna get? Okay, so you have to have fuel for your brain. And typically in testing sites, they don't allow you to chew gum or things like that, at least as far as I know. That's changed. You can definitely do that if they allow it, but I don't think they do. But peppermint is also a great thing to be sucking on prior to you going into your testing site that day. So don't, maybe some peppermint, because it helps clear the mind and helps you focus. So if you can't take a peppermint in there, which you probably can't, suck on you some peppermint prior to you going to take your test. These are just little tips. I'm not saying it's going to guarantee you to pass the test if you ain't studied or prepared for it, but these are some tips to help kind of get you mentally focused on taking this big test, especially if you're taking it more than 1 or 2 times. So what other tips do I have? Those are the biggest ones. Also, you need to channel your energy that day or the day before, where you're not dealing with distractions and people doing things they shouldn't be doing. And that basically means that people who are negative, you don't need negative energy the day of, the day before your test. So you don't talk to people who bring about negative energy. You don't want them anywhere around you, because you need to keep your aura, your energy positive, because you need to pass this test. Okay. So I think that's pretty much it. The point is, don't give up. I don't care if you take this test 6 times. Do not give up. Take that test as often, not as often. Well, yes, as often as they allow, but take it as many times you need to take it, because at the end of the day, you want to be a registered nurse or a nurse, just a nurse. And that's okay. So I want people get discouraged. Like, I feel like I'm a failure. Nope, we just need to redirect where we need to focus. Don't think of yourself as a failure. It's just redirection, okay? Rejection, redirection. Delayed, but never denied. Okay. You may be delayed, but you won't be denied as long as you stay focused on what your goals are. So hopefully you have found this video insightful. Hopefully it's helped someone. This doesn't apply to everyone, obviously, but hopefully you have found this video insightful, beneficial, inspirational. At the end of the day, just don't give up. Just do what you need to do and don't give up. I've had plenty of people, nurses that I even know personally, who have taken that test 5 and 6 times, and they are the best nurses I have ever met on the floor. They are wanting to know, are you mentally safe? That doesn't mean you're going to be a bad nurse on the floor. It just means we need to redirect how you study, okay? Just redirect how you study and you'll be fine. But you're going to be a phenomenal nurse when that time comes. But I just need you to know, if you have to have a pity party, cry it out. It's okay. Believe me, I done cried about all kinds of things not related to this, but things which you got cried out. Get it out your system. I don't care if you have tears rolling and you up here got your NCLEX book and can barely see it because you got tears all in your eyes. I don't care. Get it done. You're going to get it done and you're going to be fine. So thank you so much for watching this video. Please follow me on IG. My handle will be somewhere here on the screen. If not, it will be in the description box below. Please like, comment, and share this video because we need to get this video and other nursing content out to as many people who can benefit from it. Because I know there's going to be nurses who coming up through this program, this nursing journey of theirs, and they need some inspiration. They don't know where to go for inspiration, and I'm your girl right here, Dr. Marida P. So thank you so much for watching, and until the next time, you all take care. Bye-bye.